I've been a mentor now for the John Flynn Scholarship Scheme for 6 years. My first student's name was Ben, and Ben and I got on extremely well because we're both golfers and we both like having fun. So we played a lot of golf in the 4 years he was with me, while he came for the 2 weeks each year. Ben was also a very keen and enthusiastic, happy sort of guy, and he just fitted into the community really well. Enjoyed the work that I was able to offer him in the operating theatre and seeing patients in the surgery, and so very positive experience, and I was very pleased to be asked to carry on being a mentor, and now I'm, for the second year, have Sarah with me, and we're pretty much doing the same things.
Well, the whole scheme is designed to give the kids exposure to what rural general practice is all about. And rural general practice isn't just about the patients you see or the job you do, although obviously that's a big part of it, but it's also about your lifestyle, your relationship with the community, because that's a very intimate one. You can't go anywhere or do anything without your patients stopping you in the street. And it's also about, you know, the kind of work that you do and how it imposes on your family life and your home life. Because you need to have a realistic expectation of what rural general practice is about. And as I said, it's not just about the work, it's about how it affects the rest of your life. And it does impose on the rest of your life, but overall that's a very positive experience.
It's important to have role models of people who can do a wide range of things. A rural generalist or a rural general practitioner is an incredibly valuable thing and something that's possible. And something I think that people need to see done well and see done rewardingly. And that's what appeals to me about mentoring people who are going to do that sort of work in the future. Yeah.
By mentoring medical students in rural and remote areas, I think you can give them give that individual an idea of what it takes to become a GP in an area like this. And certainly you do need particular qualities, both personal qualities and professional qualities, to make it a sustainable, enjoyable job. I think it would be absolutely fine for me if a medical student came along, saw that it was a tough area and something which they weren't perhaps as interested in, and then chose in the longer term not to do that. To me, that it's still a valuable experience knowing what a rural GP does. But what's more likely with the John Flynn scholarship holders is that they come along and realise that they do enjoy the challenge of the medicine, and it's not, they don't just think of these remote areas as being some scary place where you're stuck doing everything and you're going to be on call 24 hours a day and it could be a nightmare. They come to realise that you come to a place like this, you get a lot of community support, you get a position of respect in the community, and you do some very interesting medicine, lots of challenges, but can have a really fun time while you're doing it.
So we get students in our practice to try and do things as much as possible themselves. And the feedback we get is that that's why they enjoy coming to this practice, because they do a lot, and that's when they really learn.